We follow closely the trending changes of the variants home and abroad to keep up pace with time. Today we will focus on the measures optimized for international travelers. We have with us Director General from the Consular Affairs Department of Ministry of Foreign Affairs, Madam Wu Xi, DDG from Health Quarantine of GACC, Mr. Li Zhenliang, from National Immigration Administration, Director General of the Border Inspection Department, Mr. Liu Haitao, and DDG Kong Fan Wei from the Flight Standards Department of CAAC. Senior researcher from Biology Institute of CDC, Mr. Chen Cao, to take your questions. Now the floor is open for questions. Please identify yourself before you ask questions. Now, the first question goes to the journalist on the second row from the left side. Thank you. With Phoenix TV. After we downgrade COVID into Class B infectious disease, what are the differences in the measures governing international travelers? And what is the status quo after we adopted the policy adjustment? Madam Wu Xi is taking the question. Thank you for asking me the first question. I'd also like to thank National Health Commission for hosting today's press conference. It gives me great pleasure to join all the department colleagues from the Interagency Task Force of the State Council to provide policy interpretation to measures governing international travelers after we downgrade COVID. This is a question of great interest by those who need international travel. The new measures are formulated based on the general plan for downgrading COVID, the law on border health quarantine. And in its formulation process, we've given full consideration to the pandemic situational changes, the needs of response, and the needs of the general public for international travel. The general principle of these measures is to promote the normalization of international travels. Of course, we will adopt necessary measures to prevent the new resurgence triggered by imported cases or imported virus. In specific, after we downgrade the COVID into Class B, in the measures of governing international travels, we have made adjustments in the following aspects. First, we trim procedures for visiting China. International travelers don't have to apply for health code from embassies and consulates abroad. Pre-departure, the international travelers can fill their 48 NAT test result into the health declaration card. Those who test positive can come to China. Those who test negative can come to China. Those who test positive will come after they test negative. We've resumed the issuance of visas for residence visits, transit, business, family reunion, family visits, and private affairs to facilitate foreign travelers to come to China. Second, we've increased the international flights. We've removed the restrictions on the numbers, routes, and occupancy rates of international flights. And there has been a steady increase of international flights numbers. The land and water crossings are being reopened in an orderly fashion. Third, we've removed quarantine for inbound travelers. International arrivals don't have to undertake centralized health quarantine. As long as they have a normal health declaration and they can go through the customs regular quarantine, then they can come to China. If they have symptoms like fever or other symptoms, the customs will take PCR testing or antigen testing. If they test positive, they are advised to have convalescence at home. These practices are to protect the health of the travelers and to prevent resurgence. Since we adopted the new measures on 8th of January 2023, we've seen a steady increase of the international travelers. Later, our colleagues from the NIA will provide specific numbers if you need. We've learned that all the crossings are operating steadily. We are confident that with the further optimization of response measures, we will see the coming back to normal of international travels. Thank you. Next question, please. Next question goes to the journalist from the right side. With CNS, after we downgrade COVID, we don't have the mass testing, but still we have 48-hour NAT negative result. Why are we keeping this measure? Will that compromise international travel? I will still ask Madam Wu Xi to take the question. Thank you for your question. We've been scientific, targeted, and effective in our pandemic response. We dynamically adjust and optimize the response measures. After we downgrade COVID, it's not that we let it rip. We should still prevent cross-border transmission of virus, but we will facilitate cross-border travels. As we all know, the pathogenicity of Omicron may have attenuated, but its transmissibility is still quite strong, in particular in cross-border long-haul travel. Many travelers are in a confined space, which has increased the risk of catching the virus. That's why we require the international travelers to have an NAT test 48 hours pre-departure. This is to ensure that the traveler is not infected, the traveler is on a safe journey. And this is also to prevent the further transmission of virus. And after they arrive in China, customs will conduct antigen testing for those who have an anomaly in their health declaration or who show symptoms, with the purpose of early detection, early treatment. If the travelers are healthy, then these measures will not compromise their international travel. Thank you. Next question goes to the journalist on the third row from the left side. Thank you. With China border news. After we adopt the new measures on 8th of January, are there any changes to the international traveler numbers? Soon it will be the Spring Festival. What will be the further measures adopted by NIA? Mr. Liu Haitao is taking the question. Thank you for your question. It is a question of common interest. After we downgrade COVID, with further optimized measures governing international travelers, NIA has correspondingly adopted optimization measures for the management of immigrants. Since the new measures are adopted on January the 8th, we found a steady increase of the international travelers. And the changes are reflected in the three following aspects. First, there has been a substantial increase of the number of international travelers from the 8th to the 12th of January. On a daily basis, there had been 490,000 trips, 48.9% over the period prior to the policy change, and 26.2% of the same period of 2019. There had been a steady resumption of the number increase for the land, port, and air borders. The international trips made at the ports, the land, and airports have been 21,000, 424,000, 45,000, respectively, an increase of 13%, 53.3%, and 33.2% prior to the policy were adopted. There has been the greatest number of trips at Shanghai Pudong International Airport with a daily average of 11,000. And for the land crossings, the greatest number came from Futian land crossing with a daily average of 21,000 trips. There has been a slight increase of inbound travelers. The average inbound trips, 250,000, 54.7% increase over the period prior to the adjustment. Soon it will be the Spring Festival. It is expected there will be further spikes. NIA has deployed local immigration authorities to improve the measures in the three following aspects.
First, we will strengthen the customs clearance inspection and organizational support, and we will make full preparation for the staff requirement and improve the logistics organization, improve the inspection efficiency, and ensure the smooth clearance. And the Chinese citizens, when entering the entry point, will not have a queue time exceeding 30 minutes. And second, we will also strengthen guidance and reminders. We will give timely updates on the possible peak for entries at the ports in order to provide early information to the travelers. And third, we will also strengthen monitoring of the clearance traffic. We will coordinate with relevant departments and get the information about the adjustment of the international flights and also shipments and freights, monitor the changes of the traffic, and develop response measures. So I'd like to remind the travelers to pay attention to the relevant platforms for more information. And before they travel, they need to ensure that their travel documents are effective, and they need to learn in advance the relevant policies of the destination countries in order to make good arrangements for their travel and improve their protection. Thank you. Xinhua News Agency. After the categorization B management was adopted, what measures have been taken to ensure the COVID-19 prevention and control at the ports? Mr. Li Zhengliang, please. Thank you for your question. Since the outbreak of the COVID-19, the customs have implemented the central government's arrangements and adhere to the requirements of customs quarantine and prevention and control. And we have made our own contributions to the national efforts to fight against COVID-19. After the policy of categorization B management was adopted, the General Customs have followed the State Council's joint mechanism for control and prevention of COVID-19 and followed the relevant provisions for prevention and control and conducted scientific work in response. First, we have improved the inspection measures for the entrance at the ports. According to the relevant requirements of the Joint Prevention and Control Mechanism, the customs no longer take the nucleic acid tests at the entry points for all the travelers. And second, we also adopt a categorized approach about the health declaration results. If the health declaration is okay and the regular inspection at the port turns out to be okay too, then the people will be permitted to go through the customs points. And if there are any abnormalities, the customs will take the tests at the port for the people, and if they turn positive, then they will inform the local joint prevention and control mechanism and do the relevant disposal work. And Also, we want to invite all those travelers coming into China that they need to take a nucleic acid test 48 hours before they travel to China. And if it's negative, then they can come to China. Otherwise, they should wait until they turn negative. And also, if they enter the border, they need to truthfully and faithfully fill up the PRC health declaration card. If they are dishonest, the customs will also hold those people responsible according to relevant laws. And third, we have also improved the inspection measures for the imported goods. And the customs will no longer take any sampling tests or preventive disinfection measures on those imported cold chain products. And at the same time, we will continue to implement the four most strict requirements and continue to maintain communication with the relevant countries. And we will also ensure that the overseas regulatory bodies and those exporters will take main responsibilities. And we will urge them to implement the FAO guidelines. If we find any problems at the origin, we will also handle them in accordance with law. Since the categorization B management was adopted, clearance has been quite smooth. And in the future, we will continue to do our effort to prevent and control COVID-19, especially the monitoring of XBB. And we will take a multi-pronged approach to ensure that we build a strong front line against COVID-19. Global Times. So we know that after the category B management, there will be a lot of increase of the travelers coming into and out of China. So what is the response of the Foreign Ministry? Thank you very much for your question. Actually, after this measure was adopted, the Foreign Ministry have organized the foreign missions to do a lot of meticulous preparatory work, and they just get more information about the local conditions and formulated detailed rules and give timely updates and guidance for the travelers. At the same time, we are trying our best to do a good job in consular services, assistance, and protection. And we are now also improving the 12308 hotline so that all of the overseas Chinese can just reach China anytime, and they can get the help anytime. At the same time, we are also working on the app, which is called China Consular Affairs. And on this app, we will open more functions, for example, the issuance and application of passports, visas, and pension qualification certificates, etc. But of course, probably we cannot meet the full requirements of the people, but we will try our best to do a good job in serving the people. At the same time, I would like to provide some suggestions to those people who are traveling out of China or coming to China. First, they need to make good travel plans according to the situation and do necessary things to ensure their personal health, and that will ensure that they're safe during their travel.
Second, have prior understanding of the destination countries' policies. Third, download China Consulate app and fill the information in the registration form of the overseas nationals so that our consulates and embassies can provide you with the needed services. And fourth, for all the international arrivals, according to our requirement, have your PCR tested within 48 hours pre-departure and bring your testing report with you for potential check. Provide health declaration through the customs app. And after you return home, please follow the jurisdiction's local pandemic response policies. Next question goes to the journalist on the third row from the left side. With People's Daily, on previous press conferences, information related to Omicron BQ.1 XBB was shared. What is the latest progress in the prevalence of Omicron, home and abroad? I'd like to invite Mr. Chen Cao to take the question. Thank you for your question. Across the world, since it occurred 1 year ago, the sublineages of Omicron has numbered over 750. As of the 10th January 2023, in the GSAID, based on the analysis of international uploaded data, the most dominant sublineages in the world are BA.2.75 and BQ.1.1. As of the 10th January 2023, across the world, we've found 72 sublineages as a recombinant of Omicron variants, with the most dominant as XBB and its sublineages. Since these two dominate the infections across some countries, XBB.1.5 is a sublineage of XBB. Its transmissibility has seen further increase. As of January the 12th, 2023, XBB.1.5 had been found in at least 40 countries and regions. And for our country, between December the 1st, 2022 and January the 12th, 2023, among the sublineages we monitor in 31 provinces and COPs, we found 19, among which the predominant are BA.5.2 and BF.7. The two add up to 97% of all the sublineages that we've monitored. Since last October the 1st, in our country, we've reported 16 domestically acquired cases infected by XBB sublineages in total. Up till now, we have not monitored any other domestically acquired cases infected by XBB.1.5. And the domestically acquired cases from BQ.1 was 56 in total, including BQ.1, BQ.11, BQ.12. Since December the 1st last year, domestic monitored data has shown 79 sublineages have been imported into China, with BA.5.2, BF.7, BQ.11 as the top three. Thank you. Next question goes to the journalist on the second row on the right side, please. Thank you. With China Civil Aviation News, since we downgrade COVID into a Class B infectious disease, and in response to the surge needs of international travel, what are the measures adopted by the CAAC. Mr. Kong Fanwei is taking the question. Thank you for your question. To implement the general plan of the State Council Interagency Task Force of downgrading COVID, and in light of realities on the ground, CAAC has adjusted industry policies. We've removed the previous high-risk rating and occupancy restriction and closed-loop management measures. We require all departments to prioritize safety and follow the principle of market-oriented resumption of international flights. We've removed the measures for designating another city of entry for the international travelers' arrival in Beijing. We've optimized the measures to provide convenient services to international travelers, and this week, international passenger flights numbered 563, 78% of the level prior to the pandemic. Going ahead, as the need of the international flight market further improves, it is predicted that the international travel will continue its steady resumption and increase. We will follow a gradual and steady process, have a scientific and sensible arrangement of international flights, and meet the needs of domestic and international travelers. We will have a good pace of resumption to ensure safety is always our top priority, and the increase of flight numbers can meet the needs of different industries while we safeguard safety as our bottom line. Thank you. Next question goes to the journalist from the right side. With the CGTN, we've noticed that China has held many technical exchanges with the WHO and other countries. We've provided briefing to the diplomats in China, the industry and business community, and the foreign press on our response strategies and measures, but still there are some rumors and demeanor of China's anti-pandemic achievements and misinformation. What is your assessment? I want to make it clear that over the past 3 years, China's anti-pandemic efforts have not only safeguarded the life, safety, and health of the Chinese people, but also made great contribution to international efforts. When we were hit by the onslaught of the pandemic, we were faced with an original strain with strong pathogenicity. We prevented domestic onward transmission and prevented imported cases. And we prevented the transmission to other countries. We've saved great time for the international community to fight the pandemic and to be prepared. We shared the pandemic information, the pathogen information, and the genomic sequencing with the WHO and the world at the earliest opportunity. We released diagnosis and treatment protocol and response protocol at the earliest opportunity and provided scientific evidence and support to the international community's efforts in its response, vaccine and testing reagents, research and development. We've provided 153 countries and 15 international organizations with hundreds of billions of anti-pandemic supplies. 180 plus countries and regions and over 10 international organizations have co-held pandemic response, medical treatment, and other technical events with China with a total number of 300. 34 countries have received 37 contingents and health team from China. We have shared our experiences in an unreserved way. We made the earliest commitment to use our vaccine as public commodity for the world, and we took the lead in support the intellectual property rights waiver for the vaccines. We collaborated with developing countries in developing vaccines. 120 countries and international organizations have received 2.2 billion vaccines from China. We made good use of TCM, and we held over 100 anti-pandemic experts video-linked virtual meetings with other countries. 150 countries and regions have learned the TCM diagnosis and treatment protocols, and many have received our TCM. We stand ready to cooperate with international community and jointly respond to the challenge of the pandemic and better protect the health and life of peoples around the world.
I have a question for DG Wu Xi. In response to the COVID-19, some countries have been criticizing China for the lack of transparency or the lack of communication with the WHO, or they say that probably China will have some new mutations which will influence other countries. What is your view? Thank you for your question. Since the outbreak of COVID-19, China has been following the principle of openness, transparency, and responsibility in sharing the relevant information and data with the international community, including the virus gene data of China's recent infections, and China has maintained close communication and cooperation with the WHO, and we have had over 60 technical exchanges with the WHO on prevention and control, treatment, vaccine, and virus traceability. And in the recent 1 month, we have conducted 5 exchanges. According to the update on January the 4th of the WHO, the data provided by the China Health Commission shows that now the strains in China are actually in line with the gene sequences of the infected passengers provided by other countries, and there are no new varieties. And also the regional director for Europe of the WHO has also said that China has been sharing the genetic sequence information to the international community. And according to the WHO, China's situation will not have a big impact on Europe. And also on January the 9th, Singapore, the health minister, also stated that now the Chinese travelers have shown no mutated strains. And actually, in the last 4 weeks of the 2022, the Chinese infections accounted for less than 5% of the total imported cases of Singapore, which is much lower than ASEAN, Europe, and the Middle East, which is 50%, 11%, 9%, especially, respectively. So such criticism is unwarranted. After the categorization B management policy was adopted, the relevant department has improved the monitoring. And now we have canceled the entry point tests and centralized quarantine or separation. How can we ensure timely monitoring of the new strains imports? Thank you for your question. After the new policy was adopted, China has cancelled the nucleic acid tests and centralized separation measures at the entry points. But the disease control departments have also been working together with the customs departments to conduct monitoring of the imported new strains. And the entry points are the first line of protection, and we have established the ports monitoring sentinels. If we find some crossing in terms of time and space or cluster, the disease control departments will issue warnings and take corresponding measures. In addition to the ports monitoring, we will also have sentinel hospital monitoring. We have established sentinel hospitals in 31 provinces, and each hospital will take the suspected cases samples every week, and they will send them to the local disease control centers for sequencing of genes, and the results will be reported to the CDC Virus Institute in a timely manner. And we will make timely analysis and provide timely feedback. And when we find risks, we will give early warning. And now the Spring Festival is coming. There will be more and more travelers going back home. Here, we would like to remind those people who are entering China, if you enter China and you find yourself not in a good health position, and you need to contact the customs for sampling. And after you enter China and you are not fine, then you need to carry out nucleic tests and the relevant tests in order to get timely treatment. Thank you very much. Thank you. CCTV, CGTN. We know that after the new policy was adopted, there have been a bigger demand for going abroad. And there is a lot of increase of applications for travel documents. So what are your measures to serve the new demand? And in addition, some countries have taken some restriction measures against the Chinese travelers. What is your suggestion for the Chinese citizens going abroad? Mr. Liu Haitao, thank you very much. After the improved management policy was implemented, the domestic citizens can apply for ordinary passports or apply for the documents to travel to Hong Kong for business or for travel. Since January the 8th, we have received the application for our travel documents numbering 1.351 million, up by 129.4%, and 353,000 people apply for ordinary passports, up by 89.8%, and applications for documents to Hong Kong, Macau, and Taiwan stood at 998,000, up by 147.6%. So in response to the big increases, the relevant public security departments at different localities have issued the application guidances, improved traffic monitoring, implemented online administration, and extended working hours, and also improved the procedures to improve their services. And now we can see very good, smooth operation at the 3,200 public security entry and exit windows. And we know that as the Spring Festival is coming, there will be more and more demand for traveling abroad, and there will be more and more applications for travel documents. And the National Immigration Administration will make dynamic adjustment to the management measures in order to provide facilitation to the applicants. Just recently, some of the countries have taken restrictive measures against Chinese travelers entering their countries. For example, the provision of the nucleic acid test, negative results, or the centralized separation of those positive travelers or the limitation against entry. So we want to remind all of the relevant travelers to get early information about the relevant policies of the destinations and make necessary preparations in order to avoid losses. Thank you very much.
谢谢主持人。总台央视中文。
With CGTN, we've noticed that some countries have adopted restrictions on arrivals from China. China has launched our protest by adopting countermeasures of reciprocity. What is the rationale? Madam Wu Xi is taking the question. Since the outbreak of the pandemic, we have been adjusting our pandemic response policies in light of realities on the ground, and we see all countries as equals. After China announced our downgrading of COVID into Class B infectious disease, many countries have well received our adjustment. Thailand, Maldives, the Brunei, Russia, and Cambodia have expressed their aspiration for the arrival of Chinese citizens. On January the 9th, the Vice Premier of Thailand led cabinet officials and received a plane load of 286 Chinese tourists at the airport. And in the airport, there is the banner, Chinese and Thailand people are a family. This is a testimony of international community's trust and support to us. Also, it shows the great friend ties between China and other countries. Regrettably, some countries, regardless of science and facts, have unilaterally adopted discriminatory inbound travel restriction measures. We can, of course, not accept such measures. I don't think any country in the world would allow other countries to adopt discriminatory policies for their own nationals. China's countermeasures in reciprocity is adopted to safeguard the legitimate rights and interests of the Chinese citizens and to safeguard the normal people-to-people exchanges among countries. In fact, we've already made appropriate arrangements for these countries' visits for foreign affairs and emergent business affairs. It is our hope that relevant countries can remove these discriminatory restrictive measures targeted at China at an early stage and work along with us to ensure the normal people-to-people exchanges and promote the friendly ties between countries. I'd like to take the opportunity to reiterate that China supports the international travels and we will continue to make efforts to provide convenience to the business people coming to China. We understand the reasonable and sensible response measures adopted countries, but we are opposed to discriminatory measures or politicizing pandemic response. Next question goes to the journalist on the third row from the left side. Thank you, Mr. Moderator. Expert has talked that BQ.1 and XBB have become the dominant variant in some countries. After we reopen our borders, will these variants trigger a new spike? How can the general public protect themselves? Which media are you with? With the 健康报. I'd like to invite Mr. Chen Cao to take the question. Thank you for your question. Indeed, this is a question very much under limelight recently. Many people have experienced in high intensity in the previous spike. Many may have already suffered from fever, sore throat, cough, or even the body ache. And all these symptoms are the immune response of the human body in fighting the virus. In the next months to come, the immune system of the bodies have the immune memory against the novel coronavirus. And this immune memory will elicit a high level of antibody. It can also elicit the immune memory cells In this context, because of the high-level neutralizing antibody in most people's bodies in the short term, even if there is the introduction of Omicron variant, it is not highly likely that it will further trigger a large-scale domestic prevalence. It is even less likely, especially after there had been the population experience of the infection spike. However, for people at risk, including people 65 and over, people who suffer from underlying diseases, and unvaccinated or under-vaccinated people, they may suffer from infection or even secondary infection, reinfection, because of the importation of new variants. So we like to remind the general public not to neglect protection, and neither is it necessary to panic. Families who co-live with their elderly should have a good ventilation, disinfection of the indoor environment, have good hand hygiene. We remind the general public to have a healthy lifestyle, a good tempo of living, good physique and psychology. We should always take primary responsibility for our own health and protect others around us. All the institutions and organizations are also accountable to remind their employees to have good personal protection and provide them with necessary protection conditions. Have a good registration of the absence or sick leaves. Leave enough time and for treatment for the infected employees. Do not work when they are sick. And there should be good disinfection of the public space in these organizations. Thank you. Next question goes to the journalist on the third row from the right side. With the China Daily, since January the 8th, we downgrade COVID into Class B infectious disease, and we've been optimizing the Immigration Management Administrations, which has promoted the international exchanges, but we've seen some countries have adopted restrictive measures for Chinese arrivals. How would we respond? Mr. Liu Haitao is taking the question. To promote the immigration management efforts after we downgrade COVID in a steady and orderly fashion, starting from January the 8th, the NIA has timely resumed our review and approval for the extension, the reissuance of the visas for foreigners for their stay visas, residence permits. If the applicants have emergent needs, they can apply for emergency review and approval. We've resumed the issuance of visas at the borders and resumed the border transit policies on 24, 72, and 144 hours. All these measures have been adopted smoothly. People from all walks of life have well received these measures. Since we adopted the new measures, inbound travels numbered 150,000. We've issued 15,000 visas for foreigners, an increase of 38.9% and 106% over the period prior to the adjustment of measures. After we have optimized the provisional measures governing international travels after we downgrade COVID, a handful of countries have adopted excessive and discriminatory restrictive measures on Chinese arrivals. We say a resolute no to these measures, and we've adopted corresponding measures in reciprocity. NIA has suspended the visa issuance for the Korean and Japanese arrivals starting from January the 11th and suspended the free transit visa waiver on 72 and 144 hours. We believe the pandemic response measures should be scientific and sensible and shouldn't be engaged in discriminatory practices. Still less should it compromise the international exchanges China is committed to opening to the rest of the world. We welcome foreign friends to come to China to study, to work, and engage in innovative and entrepreneurial efforts. NIA will answer the new needs of the international travelers. For all the international travelers to China for work or for life, we will provide them with the necessary facilitation and convenience. We will ensure the normal international exchanges and better serve the high-quality economic social development.
Thank you. Daily economic information. After the categorization B management was adopted, how can you ensure the smooth operation of the ports? Mr. Li Zhengliang, please. Thank you very much for your question. Since the outbreak, the General Customs has been working together with the relevant departments of the country and give guidance to the local people's governments of the ports to coordinate the smooth customs clearance at the ports. And they have followed strict procedures to handle the temporary closure and restoration procedures, thus effectively ensuring the entry and exit of the supplies and the engineering machinery, etc. So that has made a great contribution to prevention, control, and economic and social development. Since January the 8th, when the categorization B management policy was adopted, according to the requirement of the Joint Prevention and Control Mechanism, the General Customs has been giving guidance to the local governments of the ports to restore the opening of the ports in an orderly manner. And now the operations of those ports have been smooth and orderly, thus providing convenient clearance services for the travelers and for trade development. Thank you. China Youth Daily. According to some reports, now we have already tested in China the Omicron XBB strain. Will there be a pandemic in China for XBB? And if infected with XBB, what will be the symptoms? Mr. Chen Cao, please. Thank you very much for your question. According to our data, in China, since December the 1st, 2022 to January the 12th, 2023, we have only monitored one native XBB infection case. For the same period, for the imported cases, we have monitored 33 XBB and substrains coming from 20 countries and regions. According to the current situation, we can see that the risks for imported XBB and its substrains are big, and there are also big risks for related domestic cases. But for now, there has been no epidemic of XBB in China yet. According to the data, although XBB is highly communicative or infectious, the symptoms actually is similar to the symptoms of other strains of Omicron. the last two questions. And we can see more and more travels in China and out of China. And against this backdrop, more and more people will go abroad. How can they ensure their safety during their flights? And what will be the preparations on the part of the government? Mr. Kong Fanwei, thank you very much for your question. And now the COVID-19 is still with us. So when we go abroad, we need to do a good job in personal protection, especially at the airports or in the airplanes. And the Civil Aviation Administration has revised the 10th guidance. According to the current situation, we have improved the relevant prevention measures. At the selling points, we require the carriers to inform the travelers about China's policies, and at the airports, they need to disinfect the toilets and handle the waste properly, and they also need to remind the travelers to wear masks and refrain from moving around in the planes. And at the airport, there should also be continuous measures for intervention. And there should also be continuous ventilation and disinfection measures. And also we want to remind the travelers that before they travel, they need to know in advance the policies of the destinations and do a good job in personal protection. And on our part, we will also better implement the prevention policies to ensure an effective, healthy, and safe travel environment for all the travelers. Thank you. Last question. We have noted that the current travel measures are temporary measures, and how long will those measures be valid, and will they be improved in the future? Madam Wu Xi, actually, over the past 3 years, the travel measures have always been in the process of adjustment according to the dynamics, and we will continue to follow the situation and make proper assessment of the relevant situation to improve the measures and do our utmost to promote the normal contacts between Chinese people and foreigners. We always serve the people. That is our purpose. We will continue to implement the central government's policies and work in a solid manner. And we also want to thank the people for their strong support and understanding. And as always, we will always safeguard the national interests and uphold the people's interests. Tomorrow will be the Kitchen God Festival, so I'd like to take this opportunity to wish you a very happy Chinese New Year. And on behalf of the Consular Affairs Department of the Foreign Ministry, I would also like to wish our overseas Chinese a very happy Chinese New Year. And wherever you go, your motherland will always be with you. Thank you very much. Today, the officials have given us a lot of information about the COVID-19 related travel measures, and we will have more press conferences in the future. And that is all for today. Thank you very much for your attention.